Hello, everybody. My name is Adam Kobayashi. I'm an interventional neurologist from Warsaw, Poland. I work at the Cardinal Stefan Wyszyński University here. And today it's my great pleasure to talk to you about strategies to improve thrombectomy access in rural Poland. Thank you very much for the invitation. It is a great privilege for me and a great pleasure to be here with you on this great occasion on the World Stroke Day of 2024. Uh, to start off with, we need to have an idea what Poland looks like. This is not Middle Earth, this is rural Poland, so you can see the views are beautiful. But you have to remember that Poland, in the majority, is a rural country. You can see that in the majority of districts, over 90% of the areas are rural. So we have a smaller number of big cities, but a big number of rural agricultural areas. In total, it's over 93% in the whole country, but in some districts it's more. Here we have an exception in the Silesia region, which is an old mining and industrial region. So here it's not even 70%. So it's mainly coal mines and industrial areas. And how big population does this mean that we are talking about? According to the current statistics, it means that it's about 15 million of the population, taking into account that the whole population of Poland is about 37 million. And of course, this reflects also the accessibility to stroke units, because you can see here the white districts are those where there are no stroke units. Of course, they will be covered by those here in navy blue and blue, where we have one or more at least stroke units. So generally, the whole country is covered by stroke units, but also we have to remember that this is also a matter of how long you have to travel by ambulance or by car to get to the closest stroke unit. So here in the northwest and in the northeast of the country, we have areas where there's over 60 kilometers, which means about over 40 miles that you have to travel to get to the closest stroke unit. So here you can see how these two maps are associated. And of course, we have to remember that mechanical thrombectomy is a new emerging treatment in Poland. So here you can see that there are some areas where we are already close to 10% with the number of patients with stroke receiving thrombectomy, but also we have quite big areas here in the West where only 1% of the number of ischemic stroke patients get mechanical thrombectomy. Although we have to mention that in time, the number of patients treated with thrombectomy here, those are the bars at the bottom in blue and navy blue. Here you can see that over the years from 2018, when we just started, the number of thrombectomies has increased to almost 5% or over 5% in the current year. So this is increasing, but you can see that in rural areas here in the especially in the northeast, but also the Mazovia region, where Warsaw is placed here in the middle. There's still low accessibility, of course, also in the west of the country as well. Of course, the number of thrombectomies and the model of mothership and drippenship depends on whether we have a rural agricultural area or whether we have a more urbanized area. Here you can see that the drip and ship model is especially predominant in areas like here Kujawsko-Pomorskie, which has only one center for mechanical thrombectomy, and also Śląskie. Right now it has more centers, but there's quite a big number of stroke units. It's a densely populated area, so they get a lot of referrals, similarly to Łódź, but also in more rural areas like Podlasky region, about half of the patients are mothership and half of the patients are drip and ship. Here in the Lubuskie region, there's quite a small number of stroke units. So, and there are right now two thrombectomy centers. So most of the patients are referred directly. So most of the patients are referred to drip and ship, but this has changed because the number of centers has increased in the recent years. Uh, what is the story of thrombectomy in Poland? Of course, we know that we just celebrated the 10 years of the announcing of the Mr. Clean trial, which was the first positive trial in thrombectomy. But in Poland, it took several years until we managed to convince the Ministry of Health and the National Health Fund to promote the pilot program for thrombectomy. And we started off in 2018, in early 2018, with 7 centers, because this was pre-contracted by the Ministry of Health. So they designated 7 centers at the beginning to take part in this program. And here you can see that we have the distribution of these centers was not equal. We can see that 3/4 of the country were left without any access to thrombectomy. So after 6 months of this program, we have increased the number of centers to 18. Here we can see that it's more or less covered, apart from here, from the west, from the Lubuskie region, which was left aside quite strongly, but the idea was for it to be covered by the center in Poznan, a big neuroendovascular center. And of course, there are big rural areas here in the northeast, which were left with only 2 active centers in thrombectomy. So later we come up to the next year, to 2020. So the number of centers has increased. So at last here, Zielona Góra in the Lubuskie region has received reimbursement for thrombectomy. And also here in the rural part of Mazovia district in Siedlce, one other center was newly introduced to do thrombectomies here in the eastern part of my voivodeship. Actually, I worked in this center for over a year, and I have realized how lacking it is to have no thrombectomy on site with a large catchment area, because you can see that the catchment area of this hospital is quite large. In 2022, the number of centers has increased again, but as you can see, it has increased mainly in the numbers of thrombectomy centers in big cities. We have one here, a new city, which was introduced here in the south east, and here in the southwest. But apart from that, the other 5 new centers were introduced in big cities where they already had at least one big thrombectomy center. So this didn't really make sense in terms of complete coverage of the country. Last year, the number of centers has increased to 28, so this was also not a big number. Here we can see that only 1 center was added here, quite close to the Zielona Góra, here in the Lubuskie region, in a small city called Nowa Sól, which didn't really change the situation in Poland. And here we are in this year, and on June 30th, the a program for thrombectomy was ended, and right now new centers are entitled to apply, of course, under the condition of fulfilling the criteria, which were quite strict for development of new thrombectomy centers. I would just like to give you an example. What are the needs in rural Poland for thrombectomy centers? Here we have the Mazovian voivodeship, which is the voivodeship where Warsaw is based. It's a big region with about 5.5 million inhabitants, and it's quite big. It's the biggest voivodeship in terms of area. It has about 170 miles in latitude and longitude, so the distances are quite big. So here in the beginning, we have introduced two new centers in Warsaw and in Grodzisk Mazowiecki, maybe not a densely populated area, but it's quite close to Warsaw. It's about 30 miles from Warsaw, 25, 30 miles from Warsaw. So they covered the needs for part of Warsaw and here for the eastern part of the voivodeship. But here you can see that the north and south and east were completely left without any thrombectomy centers. So 6 months later, another center was introduced in Warsaw, which, as you can imagine, did not really change the situation. And 1 year after that, here, as I just mentioned, the center in the east, Siedlce, covering the eastern part of the voivodeship, but still we have a big northern part and big southern part left without any centers. So together with the local authorities, we have started a program which is already ongoing since 2019. So already for 5 years, training and supplying new angio suites to rural centers. Actually, those are not very rural because those are big cities here in the quite big cities here in the north. It's Płock, Ciechanów, and Ostrołęka with big catchment areas. And here in the south, Radom, another city where I was responsible for starting up this center. So due to other reasons, the center was up and running, but later it was a bit stopped, but the situation probably will change over the next few months. So right now we're trying to restart the center and start up these new 3 centers here in the north. So this will give, based on our assumptions, it will give the full coverage in the voivodeship. And this is not just an example. There are other centers which are in need of are running new thrombectomy centers. There are big areas in Poland. So fortunately, we will manage over the next few years to give full coverage. What are the unmet needs? We need to better identify regions which are distal from thrombectomy centers. So we need to run new centers, not in big cities, which already have at least 1 or 2 or even more thrombectomy centers, but we have to look at the areas which are very far away from thrombectomy centers and start them up over there, which of course has to be started with equipment of these centers with angio suites. And of course, AI and telemedicine would be very helpful to support these centers and also to increase patient transfer to these centers. Training, this is probably the basic that we need to train the staff over there. We have a big training program here in Mazovia. Of course, it is a bit difficult because we need to identify who actually can be trained in these centers. We have identified centers where we have neurologists which need to be trained in interventional. We have centers with vascular surgeons and cardiologists. I know that this is not probably the best way to go, but this is the only people that we have identified to be trained. Of course, apart from interventional radiologists, we have a big interventional neuroradiology or interventional radiology center in Siedlce, where the general interventional radiologists took over the thrombectomy part. We have centers with good vascular and endovascular surgery, which also manage to do thrombectomies, and of course centers with interventional cardiology. I hope that I brought to you a bit the idea what it looks like in Poland. Probably it looks quite similar in many countries in the world. Of course, in Poland, we have rural areas. We have a lot of big cities which are more densely populated, where accessibility is a bit better, but still the identification of the right patient needs to be improved, and we need to enhance patient transfer, first of all, regardless of whether it's a big city or a rural area. So I think that this is the challenge that we need to take in the nearest years. So thank you very much for your attention, and I'll be ready also to take some questions.